Hi, I'm Dr. Saunders. This is an educational video on a Brazilian butt lift, or a BBL. What is a BBL? What does this mean? It's an operation that involves liposuction and simultaneous transfer of the removed fat to the buttocks area. It's a fantastic operation in my opinion. Why? Because it actually can resculpture the areas of unwanted fat and then resculpture the buttocks area to give a more defined and attractive shape to the bottom area. The term BBL is actually a slang term, much like mommy makeover, and there's a separate educational video on this term. BBL means liposuction or liposculpturing and the fat transfer. So the surgical consent would say liposuction of these particular areas and then fat transfer to the buttocks. So I'm going to now talk about the procedure and some of the things that I think are so special to help you learn about this procedure. The liposuction or sculpturing is done to areas of unwanted fat. Typically, this is the stomach, the love handles, the back area, also the thighs. These are common areas where we have unwanted fat, and we can use this fat to transfer it to the buttocks. I use the process of liposculpturing and tumescence, which is the gold standard for liposuction. This topic is extremely important. There's a separate educational video on this topic, and for those interested, I want you to watch it. But what's important is the gold standard is the best way to remove the fat in a smooth and natural fashion, and then to have the least risks. And the fat is then used or processed to inject into the buttocks area. The surgical goal or the surgical results of a BBL is a flatter and more defined area to the locations that we suck out fat, and then a more shapely, full, and attractive buttocks. One of the important things about a BBL is you don't have to pick a large butt or a large buttocks area. Some people just want more fullness and a better shape to it. Obviously, extra fat can be transferred to give us a bigger buttocks, and someone like Kim Kardashian has had probably 3 or 4 Brazilian butt lifts, so most people don't get that type of result. But the reshaping, the fullness can give an incredibly attractive result that's an operation I love to perform and I think is often associated with dramatic results. I think the keys to the best Brazilian butt lift is the liposuction in the backside of the love handles and the lower back area. Because by removing the fat in this area, we can get a swoop into the top of the buttocks, and that swoop leads to a more defined and shapely appearance. I think that's the trick, kind of the keystone to getting the best results, and I make sure I work very closely on this area of the body, on all areas of course, but this I think is one of the tricks. The next part I'm going to talk about is a hypothetical person who is having a BBL, or once again a Brazilian butt lift, and I'm going to talk about that now. So imagine a person comes in and she wants the fat removed from her stomach and love handles and lower back area, and wants a more defined and attractive buttocks area. So she comes in for the consultation, she's had her preoperative visit, and now we have surgery. So what happens on the day of surgery? On the day of surgery, confidential pictures are taken, and then surgical marks are made to the areas that were removing fat and also to the areas that were transferring fat. The operation then begins with the patient on her back, and that's called supine. And from this area, the liposculpturing is done to remove the fat from the stomach, the front of the love handle area, and if we were doing the thighs, it would be the front of the thighs as well. Then after that's been performed, the patient is flipped onto her stomach, which is called the prone position, and she's reprepped and draped, and then fat is removed from these backside or posterior areas. So this is when the back sides are sculpted to give the top of the buttocks area and the more defined lower back and love handle area. Also, the backside of the thighs are done at that time, and all the fat is processed and harvested. After the fat is done processing, it's then injected into the buttocks area. It makes the butt or buttocks more attractive, full, and shapely, as I mentioned. At this point, the operation is finished. The patient, however, is flipped back over onto her back to awaken from anesthesia. She's then placed into a compression garment, which has an opening for the buttocks area and also so you can pee without having to take down the garment. After the procedure, the patient recovers in the recovery room. I do all my surgery in a state licensed surgery center. It's extremely clean and safe and has a long track record of safety and extremely low complication rates. After the recovery, the patient goes home. You, at this point, are instructed on all the things that are important to do. Interestingly enough, there's not that much pain from a BBL. It's not no pain, but on a scale of 1 to 10, it's on the low side, and most people are very surprised at how easy it is to recover from a BBL. The biggest trick is you have to keep off your bottom for about a month. And you'll be given tricks to do that, such as sleeping on your stomach or your sides, and there's pillows that you can use that put pressure on the thighs and keeps pressure off of the buttocks area. Pressure on the bottom during the recovery period can lead to absorption of the fat and can decrease the results. So the best results are when we can keep off the bottom for approximately a month, and most people find it much easier than it sounds. Like any surgical procedure, there are risks associated with the BBL, and I review these with you in detail during your consultation. The consultations are meant to be extremely thorough and educational. During this consultation, I review options, how surgery is done, recovery, and risks in detail, and answer any questions. This is an operation I specialize in. I do exclusively cosmetic surgery. I think this is a fantastic procedure that can really sculpture and redefine the areas treated. And I would love to see you for a consultation. I hope you found this educational video interesting. Please don't hesitate to call for any questions or concerns and schedule an appointment at your convenience. Thank you.